What's up, everybody? I'm Dave. I'm a trainer here at HPI at IBJI. You might recognize me from some of my previous work as a model, but I'm here to tell you that I'm more than just a pretty face. So what we're going to be talking about today is sets and reps. I think oftentimes we get stuck in kind of a rut of the reps and sets that we use, and so as a result, we oftentimes just automatically default to a certain set and rep scheme, like 2 sets of 15 reps to 20 reps or something like that. But what we really got to think about when we write our programs is what is the quality we want for our patient or athlete. So typically the one that we're most familiar with is muscular endurance. Sets will usually go about 2 to 4, and for this one you want to go about 15 plus reps, and then with a rest time of about 30 seconds. This is a great quality to use, especially for initial patients, really trying to get them to feel their muscles again, really trying to get certain muscles they might be missing to really start to fatigue so that they can get stronger. Outside of that, another quality that we're pretty familiar with is hypertrophy. So this one, the sets will typically be about 3 to 5, reps 6 to 12, and the rest is going to be about 60 seconds. But here, we really want to try to get that, that's where we're going to really try to get that athlete or patient to really try to build that muscular size. For instance, an athlete that just is coming back from an ACL needs that extra quad development in the affected leg as opposed to the unaffected leg. Now, where we get very confused is when it comes to strength and power. For each of these, the sets are going to be about 3 to 8, and then the reps for strength are going to be about 1 to 6, and 1 to 5 for power. The reason being is we don't want as much volume within the sets because these are very taxing exercises. Technique is quick to go down, and we really want to get that quality of strength or power. So the rest as well is going to be about 2 to 4 minutes for strength and 3 to 5 minutes for power. So with that dead space, what we then can do is then put in stuff like correctives or core work to help make sure that we're making the most of our rest time as opposed to just sitting around. From there, so a couple examples of some strength exercises would be anything that you're really trying to load up the athlete later on in their rehab, such as squats, deadlifts, RDLs, anything like that. So if you do a squat with 10 reps, you're really trying to get hypertrophy, but do a squat with 5 reps, and now we're trying to focus on strength or whatnot. Then for power, you can think about box jumps, or Olympic lifts, anything where they're going to have to be explosive. If you're doing box jumps to 20 reps, then you're really trying to get muscular endurance. But if you really want that athlete to be explosive, then you got to do box jumps with 3 to 8, 5 reps at most. Really trying to get that athlete to be better at that. So again, it comes down to what's the quality that we're training for, and then that's going to help determine our sets and reps. For that, IBJI therapists and trainers, check the link at the bottom of your email for a little cheat sheet that can help you out with this.